Home alone and feeling anxious? That's not surprising since COVID can have an effect on both your physical and mental health. We have all been affected by the virus in one way or another. Both the virus itself and the steps being taken to prevent its spread are leaving emotional and psychological impacts. The world is witnessing the emotional impact of COVID. Some of the principal causes of the emotional conditions are changes in daily habits and an ever-growing list of stressors. We are also seeing multiple psychological effects from COVID, including anxiety, depression, stress, and alcohol addiction. Before the pandemic, approximately 1 in 5 adults had symptoms of anxiety or depression. That number is now 1 in 3. As of October 12th, an alarming number of adults reported having anxiety or depression. Nationwide, 37.5%, and in California, 42.4%. I've put together some more percentages for comparison so that at a glance you can see that other factors such as age or education level play a role in the negative psychological effects of COVID. More people are affected by the effects emotionally and psychologically of COVID than from the virus itself. Several groups have been identified as being more vulnerable to these impacts. Healthcare workers and emergency first responders have extraordinary demands placed on them because of COVID. Elderly individuals have an elevated risk because of social isolation, which is also shown to worsen Alzheimer's disease. Children are being affected by substantial changes to their daily routine. College students are more vulnerable because of major changes like closed campuses and living away from family and security during the pandemic. Communities with unequal access to healthcare and protective resources, such as Black and Latino communities, are also at higher risk. LGBTQ+ communities are more vulnerable because of reduced access to identity-based alliances. The good news is, according to the Department of Psychology at the University of Houston, based upon decades of research, we can expect that the majority of the population, regardless of level of proximity to or interaction with COVID-19, to demonstrate resilience and to recover psychologically in the aftermath of the pandemic. As we pull together as a community and as a nation, we can be optimistic that our hope and mental health can be revived. Thank you.